As of now, the webinar is being recorded, and we will post the recording on the Public Health and Local Services web pages for future viewing. I will also send slides to all registered participants following the meeting. The format of today's meeting will be a presentation by panelists. Then we will answer questions that were submitted in advance. And if time allows, we will take live questions from the audience. All participants are muted, but we will selectively unmute during the Q&A. You can also type a question using Zoom's question and answer feature. There's already been questions submitted. I've been told by participants that this is an easy feature to use. So feel free to put questions into the Q&A feature. If we can answer them at this time, we will. Otherwise, we are gathering the questions that I received in advance, as well as questions that we received during this webinar, to create a FAQ document and continue to provide the information that you are looking for as you anticipate and plan for reopening safely. So with that, I would like to turn this over to John Lane, who will present from the Washington Hospitality Association. And John, if you want to do any further introduction of yourself and your organization, please feel free to do so.
Sure, thanks, Shannon. Again, I'm John Lane. I'm the Director of Local Government Affairs for the Washington Hospitality Association. We represent over 6,000 members statewide. The hospitality industry is the largest employer, private employer in Washington. And as most of the folks on this call or webinar will know, was one of the most dramatically impacted by the COVID-19 in not only just sort of the stay at home, stay healthy orders, but you know, there was a significant drop off in business in the industry before the actual orders, as other businesses started to move remotely. So I know, like in the downtown Seattle core, when Amazon and some of the large technology firms, you know, and law firms and others sent people home, that had a huge impact. So the association has been advocating on behalf of the industry from the very beginning in trying to help pivot a lot of restaurants to delivery and takeout options. And restaurants have been open for those, but we're really looking forward to getting back to a situation where we can have the dine-in option available. And there's been a lot of dialogue with the governor's office over the last several months, and sort of got to the kind of initial reopening guidelines that the governor's office has put forward. So what we have put together is a series of resources for folks in the industry to use. Shannon, if you want to go to the next page. So we're launching what we're referring to as our Ready to Serve campaign. And by this, you know, restaurants have been, you know, doing all of the sort of cleaning and safety measures for many years. It's part of just general restaurant operations. But so we feel that we are really prepared to, you know, safely serve the public. We've been doing it during this pandemic, again, on the drive-through and takeout and pickup delivery options, and are really ready to sort of take it to the next step. You can go to the next step, next slide, Shannon. So this is a checklist in Signage. This is sort of specific for Seattle Restaurant Alliance. We represent them as well. This is a document that sort of outlines the steps that restaurants are taking, and this is something that a restaurant can be downloaded from our website. And there's a whole packet of information, and I'll reference that later in the slides. And this is something that can be posted in the front window of a restaurant to sort of talk about what is taking place to protect customers and employees, and then also sort of an ask of the customers, because they're our partner here in making sure that we can provide a safe dining experience. So, it's a checklist of things that are in alignment with the governor's office directive for opening up in phase 2. So it has pieces like providing hand sanitizer, making sure tables are spaced out 6 feet apart, limiting parties to no more than 5, sanitizing items on the tables, increasing our scheduled cleanings, and making sure we screen employees at the beginning of each shift. And then there's sort of the ask for the customer. We want them to, regularly use hand sanitizer, wash their hands, use hand sanitizer, and make sure they're maintaining 6-foot distancing when not seated at the table with their party, and consistent with not only the governor's office, but now in King County, wearing face coverings when they're not eating. Shannon, so go to the next page. So this is a specific website, knowledge base. If you go to the Washington Hospitality Association.org, and there's a whole host of information that's available here. And on the restaurant reopening section, if you see there on the second tab of operations, you could click there and you can get access to some of the signage that I just referenced. If you go down to and click on the sourcing tab, our business development team has listed lots of different vendors and ways to get things that you'll need for reopening, such as additional cleaning products in some cases where restaurants will want to put up some plastic barriers. There's references to kind of where you can find those. And then a really important tab there's the Washington State Guide to Reopening Your Restaurant. And if you click on that, it's a 20-page document. It has a checklist inside of it that we have co-branded with the State Department of Health that has a whole checklist of items that you need to consider as you reopen in sort of a self-inspection type situation. And it also has, again, all of the materials for posting inside and outside of your establishment. Shannon, if we go to the next one. So these are the two websites, the one for the state association, and since this is a King County presentation, I also put the Seattle Restaurant Alliance page. Those are both of our websites. And both of these have access to all the materials I just mentioned and much more. You can ask questions, for folks that are concerned or, trying to figure out some of the federal relief programs and other things. Like we have information about those there. We have webinars that we have given about the Liquor Control Board the other day, and with the Department of Labor Industries and State Department of Health about a week ago. So we're really here. We're ready to serve you as well. So if you need anything, please let us know, and we're happy to really want to say thank you to our King County partners for sponsoring this webinar today and get information out. And we're really looking forward to reopening here soon, hopefully. With that, Shannon, I pass it on to the next presenter.
Great. Thank you so much, John. And thanks for the work that Washington Hospitality Association is doing for the industry and for the health and safety of employees and customers. So just to reassure participants, we will send these slides to everyone who registered for the webinar, so you have access to the information and the links that John referred to. Now we will switch to Jen Tam from the City of Seattle. Let me just pull up her slides in just a moment. Oh, let me see. Apologies, I seem to have. I did test this earlier, and for some reason, this slide is not providing me the option. So maybe we'll just quickly pivot to our environmental health colleagues and have them present while I find the slide for Jen. Apologies. So Doug, Shauna, and Jasmine, you are on.
Hey, Shannon. Hello, everyone. This is Doug Dyer. I'm with Public Health Seattle King County's Food and Facilities Program, and I'm joined by my colleagues, Shauna Cartwright, who's a supervisor with our program, and Jasmine George, who is a health and environmental investigator. So we are the agency, as many of you know, that is responsible for licensing over 12,000 food establishments in King County with a local health jurisdiction. So obviously we work pretty closely with retail food on a day-to-day basis. So what we would like to do today is just take a few minutes to discuss a couple things. One is to talk a little bit about what does reopening to phase 2 look like. Some of you might find yourselves in different operational modes. We know some food establishments actually decided to temporarily close. So what does it look like if I need to reopen my facility to get to the point where I can comply with phase 2, or what does it look like to pivot from phase 1 to phase 2? So we'll talk about general guidelines for reopening. And then secondly, we will talk a little bit about what phase 2 looks like and what the requirements are of the governor's office for phase 2 guidelines. I just want to say though up front that although the guidelines have been released by the governor's office, questions remain. So we'll try the best we can do today to answer your specific questions. But as you can imagine, there's not a one size fits all for every food establishment. So we're really going to stress some fundamental things like distancing, monitoring employee health, hand hygiene, and in King County, of course, there's a directive to wear face coverings, because those things are the major hurdles to minimizing community spread of COVID-19. And then we did receive some questions ahead of time from food establishments, which was really helpful. So of course we will do our best to answer those questions. And I think what you'll find today is we can provide some pretty good guidance, but some of your questions we probably won't be able to answer specifically. We'll have to do some research and of course disseminate that information back out to everybody. So we appreciate you participating today, and beyond that, we appreciate your patience. Okay, Shannon, next slide. So first, what does reopening look like? Well, when we think of reopening, it kind of involves a few things. So first is the actual equipment and physical structure that comprises our food establishment. So it's really important, of course, because many folks may have actually pared down their menu, which in turn required less equipment, which hasn't been used for a while, or as I mentioned earlier, may have just temporarily closed. So it's really important to make sure holistically that all of our utilities work. So what does that look like? That's making sure our HVAC system is working properly. So that's the mechanical portion of our food establishment. Things like hoods, making sure the filters are in the hoods, making sure the fire suppression within the hood system is working correctly, making sure things like fire extinguishers are fully charged and ready to go, making sure electrical is fully functional, making sure that our plumbing system is working correctly. Really important is just to make sure that all of our fixtures, particularly hand wash stations, are getting hot and cold water. And for hand washing, we always want to make sure we have a water temperature of about 100 to 120 degrees Fahrenheit. So it's really important to check those things, make sure they're all working correctly, and make sure that when you're ready to pivot to phase 2, that you don't have to worry about a water heater not functioning properly or plumbing that's leaking and those sorts of things. It's important to flush a water system if it's been out of service for a while. So that means really running the water for 5 minutes to make sure that we're getting a good constant flow, and to make sure that we're getting particles and contaminants out of the system that may have formed. We also want to think about equipment that's plumbed. So we know ice makers are really important. We want to make sure those are emptied, flushed, clean and sanitize the interior. Some of you may use a service which comes in and monitors and services equipment, so that's obviously a good idea. But if you're going to take it on yourself, just make sure that that equipment is thoroughly cleaned, sanitized, operating correctly. The same goes for other types of equipment which have water hookups. So I'm thinking espresso machines, coffee makers, even some steaming equipment that you might find at a cook line. All really important things to make sure that those systems are flushed, that equipment is cleaned and sanitized. And of course, the same goes for mechanical warewashing. So if you have a dishwasher, either a high temperature sanitizing unit or a low temperature chemical sanitizing unit, making sure that that equipment's functioning properly, that it's cleaned and sanitized. Using your test strip if you have a chemical sanitizing machine to make sure it's dispensing the right amount of sanitizer. Typically, most machines are going to use chlorine as their sanitizer, and that's making sure that it's at 50 to 100 parts per million. Conversely, if you have a dishwasher that uses hot water to sanitize, making sure all the parameters of the data plate on the machine are met, and that typically means that the hot water during the sanitizing rinse is about 180 degrees Fahrenheit. And if you have a pressure gauge on your machine, that it's in the proper pressure range as denoted on the data plate. Next slide, please. If you have any expired or spoiled food, obviously you want to discard that. I would imagine, though, most food establishments would have prepared ahead of time. But in the event, just make sure that any food that's expired or spoiled is discarded. Also with units like walk-in coolers and reach-in coolers and hot holding equipment, just making sure that it's functioning at a temperature range that's sufficient to hold hot and cold foods properly. So your walk-in cooler should really be at an ambient air temperature range of about 36 to 39 degrees to hold those potentially hazardous foods at 41 or less. And conversely, if you have hot holding equipment, making sure that the water in the steam wells is hot enough to hold foods at 135 or higher. So typically that's going to be a water temperature of around 160 to 170. And then just thoroughly wash, rinse, and sanitize all food contact surfaces. So taking small wares and running them through your 3-compartment sink or your mechanical warewashing. Cleaning and sanitizing surfaces within the footprint of your food preparation areas is really important. And then, of course, in dry storage rooms, just making sure shelving, floors, walls, ceilings, walls, and ceilings throughout are maintained, clean, easily cleanable, smooth, and good repair. Sort of normal things that we would expect from that is required from our Washington State Food Code. Next slide, please. And then think about services you might have. So if you work with a pest control operator, and of course, trash and recycling, making sure those services are restarted. And in fact, on the topic of pest control, it's quite important because we've sort of heard anecdotally that pests became a little bit of an issue with restaurants that may have unfortunately had to close permanently or may have closed temporarily. And so really assessing to make sure that your facility has a good integrated pest management program in place to ward off any, particularly rodents, but we're also thinking flies, cockroaches, etc. So that's really important to assess that. And then, of course, areas where you would store trash, you want to make sure that those areas are clean and sanitary. And I mentioned cleaning and repairing physical facilities, but that's just assessing, again, floors, walls, ceilings, and then even the exterior of your property to make sure that there's no routes for rodents to get in, for example, and that everything's clean and well maintained. Next slide, please. This is a big one, and I don't think we can stress this enough. So when we think about reopening a food establishment or pivoting to a different phase of reopening, and many of you have been doing this already, but it's really important to make sure that we take the time to train our employees, particularly if you're going to call people back. If you had to let some people go or furlough some people, but you find that there's a need to bring people back, it's really important to take the time to train them on what the symptoms of COVID-19 are. So I believe our next slide, which we're not quite ready to go to yet, has the specific symptoms, and I'll detail that. But the message here is take the time to train the employees, train managers, train bar staff, train servers, and beyond that, you need to implement a program of screening people before they start their shift. So before anyone starts their shift, the manager or person in charge should be asking, how are you feeling today? Do you have any symptoms consistent with COVID-19? It would be really important to have a poster or some other informational material available that you can actually review with an employee. And of course, King County Public Health's website has a multitude of information that's available, free downloads. Review that even beyond how the individual employee is feeling. Is anyone in your household sick? Has anyone in your house tested positive for COVID-19? Those can be mechanisms for an employee actually not being permitted to work. So it's really important also that you delineate the difference between isolation and quarantine. We have information available for that. So that's making sure that if an employee is tested positive, they're isolating. If they've been exposed to someone who's COVID-19 positive or symptomatic, that they're quarantining. These are the big items that really help minimize the spread of this disease across the community. Next slide, please. These are the specific symptoms we want to be mindful of: coughing, shortness of breath, difficulty breathing, or at least two of the following: fever, chills, shaking with chills, muscle pain, headache, sore throat, loss of taste or smell. So really important to make sure we're in tune with how our staff are feeling, and telling them in no uncertain terms that if they're experiencing these symptoms, they can't work. Next slide, please. We obviously want to make sure hand washing sinks, I mentioned warm water earlier, but we want to make sure they're stocked with soap, paper towels, a little wastebasket to throw our single-use paper towels in. Hand sanitizer, 60% alcohol-based, can be used after hand washing. It's not a substitute for hand washing, so it's really important to make sure that people are washing their hands correctly. That's for at least 20 seconds. Singing happy birthday a couple times to yourself. Good thorough hand washing. It's every right and responsibility of the person in charge to monitor that and to coach people if they're not practicing good hand washing. Making sure employees are spaced 6 feet apart. That can be a challenge, as all of you know, in a food establishment. And that's where the mask part comes in. So we can't always be 6 feet apart, but we can wear a mask, which helps and creates another barrier to making sure we're protecting those around us. So really this combined effort of hand washing, being mindful of personal health, physical distancing, and face coverings all make a big difference in minimizing the spread. And this is a great time to remember that it's always a responsibility, even before COVID-19 and after we get through COVID-19, to develop good employee illness policies and procedures, because all those other foodborne illnesses that we're worried about, they haven't gone away. Now we just have an additional one. So norovirus is still there, and salmonella and shigella and E. coli and all those sorts of things. So I stress to persons in charge and managers to really make sure you're diligent in developing good policies and procedures for recognizing illness employees, training employees on that, and excluding ill employees from working. And of course, whenever you have questions, always contact your local King County investigator to talk it through, gain advice, ask questions, those sorts of things. Next slide, please. Customer protections, we obviously want to make sure in the front of the house that we're doing a good job of cleaning and disinfection. So you may hear disinfection and sanitizing used a lot, and there is a difference. So disinfectants typically are stronger, and many disinfectants now on an EPA list, which you may have been made aware of, are are effective against novel coronavirus. Sanitizing is what we do within the footprint of our food preparation areas because not all disinfectants are approved to be used on food utensils. So we need to make sure that we don't use the wrong chemicals in the wrong areas. So disinfectants for the front of the house, sanitizers for the back of the house, and make sure you're reading the label and using the product as described on the label. And you're doing it frequently. So those common touch points in the dining area, like the door handle, the front door handle, the restroom door handles, keypads, those sorts of things that customers are going to touch a lot. The back of a chair, moving the chair to sit at a table, tabletops, those sorts of things. We just want to be frequent and thorough and use the disinfectants as it's directed on the label. We can utilize contactless payment systems if you have the capability to do that. We can, I think I saw a question at the beginning. Someone was concerned about hand sanitizer availability. I don't have my finger on the pulse of what's out there right now, but I think sort of throughout the duration of COVID-19 so far, the availability of hand sanitizers has been difficult, but if you can provide them for your patrons upon entrance to your food establishment, that's really good. And providing posters, alerting patrons that if they're not feeling well and they have symptoms consistent with COVID-19 to not dine. It's not a good time to come into the facility and dine, because what we don't want is we don't want them spreading it to other people, and we don't want them spreading it to your employees. Next slide, please. Oh, did we? There we go. Oh. Other things you can do, you can try to maximize pickup or delivery services. We talked about disinfecting touch points. And then, of course, we have strongly encouraged customers to wear cloth face coverings. With our health officer, Dr. Duchin's recent face covering order, if you saw any of the press conferences related to that, he presented with Dow Constantine, the county administrator, and Mayor Jenny Durkin. You know, the police aren't going to be out there issuing tickets to people not wearing face coverings. However, it's just really encouraged and really important. And I would stress to food establishment operators to really monitor that and make sure that particularly when customers may be queuing up to get seated at a table, that they have a face covering on. If they're going to leave the table to use the restroom, to make sure their face covering is on. We understand that while they're at the table eating and drinking, that's obviously not feasible to wear a face covering. But those other times when they're not eating and drinking, to make sure they are. And that's really out of protection for all of us. Next slide. So this gets into phase 2. Guidance from the governor's office, and I'm sure during our question and answer session we'll be able to dive into this stuff a little bit more. But kind of the highlights of phase 2 are ensuring that groups of people, we know there's a maximum table capacity of 5 under phase 2, so five people maximum can be at a table. Distancing between tables has to be 6 feet person to person. So that's not 6 feet from the center point of a chair to another chair. That is 6 feet between individuals. So that's important to make sure that we maintain that 6-foot distancing. At this point, although I think there may be some room for some more clarification from the governor's office, reusable menus are not permitted, so it would either have to be a one-time use menu, like a piece of paper that can be recycled afterwards, or you can utilize menu boards. You could set up a whiteboard or a chalkboard that has your menu on it. If you have the capability to do a digital flat screen, you could have your menu on that. So I think a lot of this depends on what is the most feasible and the type of food establishment that you have. But I think there was some confusion early on that people had to use one-time use menus and throw a piece of paper away, and wasn't necessarily the intent, I believe. And there's cleaning and disinfecting touch points, which we talked about earlier. Next slide. So here's a summary of this phased process. I know as much as all of you do. So I'm not privy to any inside information on the confirmation that phase 2 is going to begin on June 1st. I watch the same press conferences as all of you do. It sounds like that's the goal, but the governor always leaves the door open for revising that based on the information he receives from state epidemiologists as well as local health jurisdiction epidemiologists on what community spread looks like. So right now we're in phase 1. Obviously we're in the takeout, delivery, and drive up stage only. I hope that by June 1st we can be in phase 2, but we'll have to see what the governor says. And phase 2 is a maximum of less than 50% of your total occupancy, which is based on total occupancy. So whatever the local fire marshal or building official deems as your total occupancy, and that includes your employees as well, your capacity is less than 50% of that, or 50% or less. Table size is limited to no more than 5 people. Bar service is closed. So when we think about bar, for us as food people, it's more than just a bar in which you can sit and have a beer or a mixed drink. There's sushi bars and there's tapas bars and there's all kinds of different bars. So it's our understanding that this is bar service. So any type of bar that you would sit in on a stool, for example, in close contact with other folks is not permitted at this point. It's really important to maintain the physical distancing. So we know from the scientific side about how this disease is spread through air, that distancing makes a big difference. So I mentioned earlier 6-foot spacing. So that means in our dining area, we need to reconfigure tables and booth seating and any other type of seating so that we can maintain 6-foot distancing between individuals or groups of people. So if a party of 5 is sitting next to a party of 2, all 5 people need to be spaced 6 feet from the other party of 2. So obviously parties of people can sit close together because they came in together and they have common exposure together. But those separate tables and booths need to be spaced 6 feet. And then we know originally there was a requirement that customers provide personal information to the food establishment in the form of their name and either an email address or telephone number in the event that contact tracing needed to occur. The governor's office has changed that. So it's voluntary. So a customer does not have to provide their name and contact information or identify themselves as the representative of a group of people. However, I believe the food establishment still is required to ask for that, but the customer has the right to refuse that. And if the customer voluntarily does provide that information, then the restaurant is required or the food establishment is required to retain that information. So you would have to keep a log of some sort with the name of the individual and either an email address or a telephone number. And that information needs to be retained for at least 30 days. And the reason is if contact tracing needs to occur. So let's say King County was conducting contact tracing on an individual, and that individual identified as eating at a certain restaurant in King County, then part of the tracing information would be the health department reaching back out to the restaurant to find out more information about individuals who may have been in that restaurant at the same date and time. And then I would add to that, besides the name and contact of the information, would be the date and time that they ate at the restaurant. So hopefully that's not too unclear, and we can certainly talk that through a little bit in Q&A. Phase 3, which, we don't know when phase 3 will start, but the governor alluded to a 3 to 4 week period between phases. So if phase 2 starts on June 1st, then it's realistic maybe to say phase 3 starts July 1st. However, the caveat is if we see an uptick in illness, the governor has basically reserved the right to go back phases. So if it got really serious, the governor could say, you know what, we're going to go back to phase 1. So it all depends on how community illness looks. But phase 3 is restaurants move to a 75% or less capacity. Table size is bumped up to 10 or less maximum. Bars now can have 25% or less seating capacity, and there's not a need for physical distancing. And then beyond that, phase 4 would be the business model that we've always enjoyed pre-COVID-19. Next slide, please. This is a really great diagram that Jennifer Tam from the city of Seattle created, and I just think it nicely summarizes what does spacing look like and what are the details of spacing. And I don't want to take too much from Jennifer because she didn't get to speak before, so to give her the opportunity.
Yeah, thanks, Doug. Maybe we'll use this slide as an opportunity for Jen to introduce herself and the programs that she leads and the support she provides at the city. And then she may also just walk through some of the details of this diagram that she put together, and then we'll move right into our question and answer period.
Great, thank you.
Yeah, thank you so much, Doug. And thanks to everyone for the great questions that you have raised. Jen, can you unmute yourself and maybe talk us through this and tell us a little bit more about the programs that you lead at the county or at the city? Apologies.
Sure. Yeah, thank you. Wow, at the size of this group here, recognize some of the names that are in the webinar. There's no new information actually on this list or in this visual. And oh, sorry, I'll introduce myself first. My name is Jennifer Tam, and I am the food business advocate at the City of Seattle's Office of Economic Development. And I help people navigate through the requirements and regulations when they're opening or expanding food businesses in the city. But I also happen to also work with a lot of folks who are outside of the city too, oftentimes. So about this diagram, I needed something visually to be able to show like what these different pieces are in terms of the reopening guidelines. So there's no new information here. It's really just an attempt to try to visualize like the guidance. So I think the one thing, there was a lot of confusion around like the bar seating. And I just pointed there, you can see at the sushi bar, it'd be like individual stool seats that would be in front of there that is not allowed. So that's how we understand it, and I just tried to make an arrow there. Outdoor seating is permitted. So I won't go through all of it because you guys would be able to read this, but it's just an attempt to visualize where what's allowed and what's not allowed based on our understanding of the phase 2 reopening guidance. And I want to just go through some of the resources so that we have some time to go over questions and answer afterwards. But at OED, we have a few resources that we have rolled out in response to COVID-19, actually quite a few, but I'll highlight some of them. One of them is the Small Business Legal Services. We just rolled this out. It's a partnership with Communities Rise, and what it provides is a free one-on-one appointment with an attorney for 60 minutes. And you fill out an online intake form, and you'd be able to, they respond within their goals within 2 days, 48 hours, to connect you with an attorney, and you meet with them for an hour. and it's eligible for businesses that have 50 employees or less, are Washington state-based, and adversely impacted by COVID-19. And part of this legal services also includes a lease amendment toolkit. So there's a webinar on sort of the guidance on how to navigate your lease during this time, as well as PowerPoint slides along with that webinar. And then there are sample templates for letters on how you might communicate with a landlord, and then also templates on what you might propose as far as a lease amendment. One of them is a lease amendment that includes a payment plan, and then one of them is a lease termination or release if you find that you're unfortunately unable to continue in your space and that you need release from the lease. So there are sample templates there for that, for folks to be able to use and see. And then we've also launched a SBA disaster loan technical assistance. So we are offering assistance in that way. And then as a city, we have launched a support Puget Sound small business campaign map. So if you're a restaurant and you do takeout, delivery, curbside pickup, you would be able to get on this map if you're not already, and you would be able to get onto the map by sending in your information. So it's a way to help let folks know who is open and who's able to provide takeout, curbside pickup, and delivery. And then we also on our page have a COVID-19 resources page for businesses, workers, and nonprofits. In addition to that, at the city, just want to highlight that we have been offering, the Seattle Department of Transportation has been offering temporary curbside pickup zones. And so if you are in the city of Seattle, then you can call 206-684-ROAD or email 684-road@seattle.gov to request a pickup zone. And then just want to emphasize that permitting and licensing is still required to operate. So there haven't been, as far as my understanding, there have not been any permits or licenses that have been omitted to be able to operate, although there have been some extensions of permit renewal fees and things like that. So for instance, like the health department permit has been, renewals have been extended until July 15th. So if you haven't renewed your permit yet, then you have until July 15th before you incur any fees. And that permit will still actually expire at the end of March 2021. So that's just an example. And then the city of Seattle has extended its B&O tax filing and payment deadline for first and second quarters until October 31st. So I just encourage folks to check your local jurisdictions to see where extensions may be in terms of tax filings, permit renewals, and definitely please call your regulatory agencies if you have permits and licenses that you're unable to pay to see what options might be available, because each one operates a little bit differently. And again, permits and licenses are still required, and I am here as a resource to help you navigate what the pivot might look like if you're looking at adding additional revenue line in your business, like wholesale or catering or something else. So I'm happy to work with folks on working through those ideas. And that is it for me. Thank you.
Great. Thank you so much, Jen, for joining us today and for all of the amazing resources that you just described. All those links and information is included on the slide that I wasn't able to pull up earlier, but we will definitely include follow-up information in an email so you can access some of those resources. So we'll move into our Q&A. I guess just before we get there, there's a few links for the guidelines from King County's Department of Health. So you'll have access to these links again in the follow-up email. So we received a number of questions from participants before starting, and I know that we also have a number of questions that have been raised through the Q&A. We'll start with the questions that haven't been answered yet that were received beforehand. And I will be asking them on behalf of the person who submitted the question, as well as some of my colleagues from the Business Task Force. So we did cover the requirements for collecting guests' contact information. There is still a requirement for restaurants to ask for the information, but a customer may choose not to provide that. Doug responded to the question about when will phase 2 start. It's scheduled to, or it's slated to start on June 1st, but that may change depending on our local data. And then do we have to reopen in phase 2, or can we continue to take out until the later phases? Doug or John, would you like to respond to that question, as some restaurants are choosing whether or not to reopen in phase 2 or perhaps wait?
This is Doug with King County. It's completely up to the restaurant if they choose not to open during phase 2 because it might not make business sense to do that, but continue with the model that they're currently operating on, or if they chose to voluntarily close, then there's nothing stopping them from doing that. So you don't have to reopen in phase 2. You can stay with a different model like the one in phase 1, or if you happen to voluntarily close, you could just stay closed until, if you thought it would make more sense just to reopen during phase 3 and comply with all the guidelines of phase 3, you could certainly do that.
Great, thank you. Anything you want to add?
Nope, that's right.
Okay. Great.
Hi, this is Hugo, also a member of the business task force here with King County. I work alongside Shannon and want to go ahead and ask the next question. Will the managers on site need to take employee temperature or simply ask the employee to report their readiness to help? I believe Doug already mentioned it, but if you don't mind recapping that for us, Doug, appreciate that.
Sure, you're not required to take an employee's temperature. There's different ways to do that, and there's probably a lot of variability in the type of equipment used and the person doing it. So the most important thing actually is to train staff on what the symptoms of COVID-19 are and screen them before they start their shift. So asking them specifically if they're experiencing any symptoms consistent with COVID-19, and you can review those symptoms with them. That's the more effective thing.
And that goes to the next question. What are some of those symptoms that we should be looking for to ask them to stay home?
So we had a slide earlier that delineated those symptoms. They're upper respiratory system symptoms typically. So headache, fever, muscle aches, shortness of breath. But also now we're learning with COVID-19, there can be some loss of sensation like taste, or I think primarily taste. So again, on King County's public health website, we have multitudes of downloadable posters and other information that detail those symptoms, and in multiple languages that anyone is free to use. So I'd encourage you, with the links that are provided in this slide deck, to explore those options.
Thank you, Doug. And last, what is required for them to return to work? Do we require a note from the doctor, a negative test result, or a set time period for the symptoms to subside?
So I don't know that we require a negative test. I think if someone's either symptomatic or case positive, that they either isolate or quarantine. And I would probably need, for more specific requirements, I'd probably have to circle back with our county epidemiologist, because I'm not aware of any sort of doctor's note that is necessarily required to return to work. However, we need to be sure that a person followed their healthcare provider's guidance specifically. So it's probably a question we need to explore a little bit deeper.
Great.
Yeah, I'm not aware of any requirements, just the time delay.
And during the time period where essential workers have been reporting to work, we have asked for folks to be symptomatic for 3 days before returning, but not wanting to put additional burden on the healthcare system by asking them to get doctor's notes. But we will get updated guidance and share that out. Next questions.
Hi, everyone. This is Kate Becker. I am also on the Small Business Task Force, and Here are the questions which are about bars. We have a second area, which is the bar area. I assume since bars can be open, just no bar seating, that we can have people sitting in the bar area. Is this correct?
Yeah, so you can have people, we understand that a bar area can constitute more than just a traditional bar where the stools are located, but could have tables like the high top sort of tables. And so yes, you can seat people in the area where there are tables, for example, just of course being sure that folks are spaced 6 feet apart, and then that people aren't physically at the bar on stools next to each other.
And so Doug, that second question about high top seating and the restaurant having low top seating, does there need to be 6 feet between those tables, even though they're at different heights?
Yes, the height would make a difference. So they do need to be 6 feet apart.
Thank you.
Hello, Nainona Bujwada, also from the Small Business Task Force. So a number of questions, again, that are tied to 6 feet apart. And so I'll just combine a few of them, given that they're kind of covering the same thing. So are booths considered partitioned already, or do the height of the backs need to be adjusted? Are high back booths good enough, or does there need to be more of a barrier? One like plexiglass suggested in the second one, or even skipping a table to accommodate the 6 feet distance. Could you respond to that, Doug?
Sure. So we understand with booths, the way that they can be configured. You could have booths back to back, side to side, or both. And so wherever 6 foot distancing can't be maintained, which probably becomes more of an issue later. I forget now in phase 3 if we still had we may not have a distancing requirement, but the upshot is if you can't maintain physical distancing between people, which that's always the first sort of thing you should do is do that. But if you can't, and you have booths that are back to back, and the booths have some open space between them. So let's say there's a partition that goes part way up, but then it's open above that. There's not a hard and fast rule on how high that has to be. 6 feet's been kind of tossed around, 8 feet's been tossed around. But at a minimum, we should try to have it at probably at least 6 feet. So if this open partition is less than 6 feet, then that's using something like plexiglass or some of the rigid material that you can put in there, just in the event that if someone does cough or sneeze, we don't get anything that's potentially going to affect others. But what I would say is with booth type seating is really try to space it out so every other booth is out of service. And so with a 50% or less requirement during phase 2, hopefully that can be accomplished, because I don't have the perfect answer on what partitioning looks like between booths. All I can really tell you is we just need to have barriers that can potentially minimize the risk of airborne particles if somebody, or airborne droplets if somebody coughs or sneezes. I know that's not the perfect answer, but it's really based on the configuration of your individual food establishment and what you feel is going to best protect customers. So as an example, grocery stores a while back, I'm sure many of you have been in a Safeway or QFC, what they've done at the checkouts is that they've actually installed a plexiglass shield for the person who's working at the checkout or the store employee. And while it's not perfect, because once you walk past the shield, there's still an open space, it still offers a measure of protection that wasn't there before.
Okay, thank you, Doug. And the next question I'll ask is kind of tied to that. but a little bit different. Full service restaurants like mine are not able to have 6 feet between the back of the house or between the front of the house and guests. How does one serve, etc.? Please clarify, as these requirements are a physical impossibility. And I do know that you touched on that a little bit in your presentation when it came to employees not being able to maintain the 6 feet and whatnot, but if you could just elaborate on that more. Would this business not be able to open in phase 2?
It's a possibility, but I think probably what we would need to do is I think an important thing would be for us as a regulatory agency maybe to talk to this person one-on-one and find out a little bit more about their space, particularly, have the investigator who works closely with this facility on the routine inspection part, who would have some knowledge of it, kind of figure out, realistically, can spacing be accomplished that may not be readily evident, or is there some other behavior that we can do that will help, one, allow the person to maybe have some seating, and two, still protect the health of the customers and the employees. So what I will say about we're not always going to be able to stay 6 feet apart. And anyone who goes grocery shopping, which I think is all of us, knows that by going into a grocery store, is that oftentimes you're walking past people and you're within 6 feet. What we do know about the way this disease spreads is it's really when you have more prolonged exposure. So 10 minutes, for example, to someone who's infective, where the risk of becoming infected goes up significantly. So if there's a way for us to sort of, and our goal is to work with a facility where we can somehow figure out what's a way where we can accomplish safety for the customer and at the same time minimize the spread of the virus. So again, there's not a neat answer to that fits everybody. There's not a one size fits all. So I think some of this is going to take from our behalf is getting to know a little bit more about the facility or having an investigator who's knowledgeable about the facility work with the operator. But there may be cases too where if distancing it's impossible to do it, then they may have to wait until phase 3. I just can't make a definitive determination on that now without, there would be more things that would have to work through.
Thank you for that.
I'll just add, like, this is why the mask piece comes in here, when you can't be 6 feet apart. And obviously when you're serving tables, you're going to invade that zone. But I would also just flag that this is an employee safety issue as well. And so it's something that Labor and Industries is looking at. And so what they're going to question is, were you creative? Were there ways in which you could space people 6 feet apart? And where, if it's not practicable, you need to be able to demonstrate why it's not practicable, is what we've been told by Labor and Industries.
And I think John brings up a really important point that I didn't mention before, but Labor and Industry, there's a whole nother level of regulatory oversight that is beyond King County Health Department, right? So for example, if an employee of a business wants to file a complaint with L&I about the business, and let's just pretend it's a food employee who files a complaint about an establishment they work at in which they don't feel the establishment's taking steps necessary to protect their health, then L&I reserves the right to investigate that. And I sat in on a webinar last week that one of John's colleagues had hosted, along with the Washington State Department of Health representative, and L&I was in that webinar, and they made it pretty clear that they, what their investigatory process was and what their authority was. And so I'm glad John brought that up because that's an important point.
Great. Thank you, Doug. Thank you, John, for those responses. We are at time. It is currently 2:03. We did have a number of other questions, and we will work to answer the additional questions as well as the questions that were raised in the Q&A in follow-up communications. So I'll just quickly scroll through, but we won't have time to answer these at this time. But the questions that we will follow up on include limiting our, actually this one might be a quick one. Are there any limits to the hours of operations, or can a business continue to operate during their normal business hours?
No restrictions.
There's no change.
Great, no restrictions. And then with entertainment and games in the restaurant, this is one that I've heard from a number of folks as well. Are we still waiting for guidance, or do we have on what entertainment and games will be allowed?
So we are waiting for more specific guidance, because I know this, I just mentioned another webinar that was last week, and this was a big question, is what about pool? What about video games? We know fundamentally spacing needs to be achieved, but I think the governor's office needs to provide more clarification on that. Within our own team, we were wondering about a music club where you might have a jazz band, for example, and people listening to music, and you know, we don't think dancing is necessarily permitted at this point under phase 2, but there's a whole host of other questions. So you know, I think more to come, and certainly from our standpoint at King County is making sure we keep that information up to date, real time.
I would just mention that these are high touch points. So if you were going to, you know, and Doug said there's potentially more guidance, but all of these would need to be regularly sanitized for folks that are touching all of these equipments and video games and other things. So you just need to take that into consideration as to, like, you know, it's similar to what you're going to need to do to be able to, you know, clean if you have like a soda machine that requires a touch screen, etc. So just have to keep that in mind.
Thank you. So we will get to the rest of these
This looks like for
in a follow-up message. And there's questions about changes to service, wine tasting, catering companies, and non-food establishments that allow carry-in from customers. So we'll follow up with answers to these questions where possible via email. I will send out all of the slides that were used today, including Jen's slide, which you didn't see, as well as links and follow-up answers to any of the questions that we provide. And then we will look at the questions that were raised and see if they warrant another conversation, and we can organize another webinar, perhaps with labor and industries, or with some of our public health, other public health folks, as well as environmental health, to answer any of the questions that still need to be answered as you prepare for reopening. So I really appreciate you joining us this afternoon. Appreciate the discussion and the time of our panelists, and will be available via email. You can email me additional questions, and we'll continue to try to consolidate those and get answers posted so that you have the information that you need to reopen safely. So thank you for your time this afternoon. Thank you to our participants, and with that, we will adjourn. Thank you so much.
Did I have my mic on? Shannon, this is Shauna. Are you there?
Yes, let me just recording just a moment.
Oh, sorry.